Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Some very interesting, very new questions. The very first question is, Dr. Bob, cirrhosis of the liver. How can I help it? And also they mentioned it was due to diabetic meds. Very interesting because cirrhosis of the liver is literally scarring of the liver itself. And you make an interesting point. Medications, drugs have side effects, but they're really bad effects. So what I have found is there's an herb called silymarin, also i.e. milk thistle. In our practice, we use a product called Livitrit Plus. But what's quite interesting, you don't want to just use one herb. There's a combination of what we call phase 1 and phase 2 of detoxification. The herbs themselves literally place a demand on the liver. Eating radishes would be good. A castor oil pack would be good. I may suggest that you would consider some blood tests, checking your liver enzymes to see what's going on. In our practice, we take films standing up to make sure you don't have a fatty liver. I would not eat fruit, and I would not juice. That's for all of you juicers out there. Dr. Bob, what do you suggest for an alternative to conventional vaccines? You know, this is very controversial. No vaccines. It's pretty much that simple. My heart goes out. I just saw a young girl yesterday. I know that her challenge had to come from a vaccination. 18 months, the MMR just destroys these children. You know, we're giving them so many vaccines. I know that Dr. Tenpenny wrote a book on vaccines. Get the movie Vaxxed. I think it'll just open up your eyes. Dr. Bob, and this person went on with a very extensive conversation about their thyroid gland, the TSH and the T3 and the T4. First, I would encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones, Dr. Bob's Men's Health, the Basics, or Dr. Bob's Guide to Prevent Surgery. I go into great detail about thyroid function. Your TSH has everything to do with your pituitary gland. If your TSH is high, traditionally it means you have a low thyroid. But we also know that the TSH is low, which is thyroid stimulating hormone that comes from your pituitary gland. If your TSH is low and your T4 is low or normal, it's not a hyperthyroid. So there's a lot of different ways to look at these numbers. So we look at a TSH, a T3, a T4, and a TPO to start. TPO will let me know if you have Hashimoto's or an autoimmune problem. Now, what about craving sugar? What is one product? We use chromium. The product that we use is called CR-Zyme. You could also use some alpha-lipoic acid. Stay away from sugar totally. Now, Dr. Bob, what about sugar that comes from fruit? We're very interesting about this because I've read a lot about sugars and fruit, and I know, as I have read, fruit can raise your triglycerides. Your triglycerides are fat in the blood. I only eat a half an apple every day, and I have so much conversation with people about they want to eat dates and figs and raisins and pineapples and watermelon. And you want to do that, it is okay. But I'm going to tell you what, it's placing a demand on your pancreas, and your pancreas takes away inflammation. Very last question. Very interesting question, because somebody wanted to know if caffeine would cause an enlarged prostate. Well, see, caffeine, from my observation, is going to place a demand on your adrenal glands, and your adrenal glands make hormones, sex hormones themselves. So I really tell you that, honest to goodness, thinking about all this when I was coming up with the answers, your prostate would enlarge with too much estrogen and probably not enough iodine and a compromised liver. Tremendous questions. I'm Dr. Bob DiMaria.